After adjusting the upper occlusion block, now I have to adjust the lower occlusion block. I remove the wax as I did with the upper. I get my wax. I start softening the wax. The wax should be very soft with me so that I can shape it and place it over the crest of the ridge. I take the wax, I start from inside to outside. Shaping the wax, I press from inside to outside to remove any air bubbles that can be entrapped inside the wax. I just take about quarter of the sheet, not more, because I don't need a lot of wax. For the lower, I will place the wax over the crest of the ridge and I will follow the shape of the arch. The wax for the lower has no labial inclination and no canine eminence. The lower wax should be at the crest of the ridge. I start to stick the wax and adhere the wax to the trial denture base. Then I will use the wax knife to adjust the wax. For the lower occlusal plane, it should be parallel to the residual ridge or parallel to the floor. No inclination or is present in the lower occlusal plane. It should be parallel to the foundation area. As you see, I just remove the excess wax to keep the lower occlusal plane parallel to the floor or parallel to the main foundation area. The lower occlusal plane is also should be below the retromolar pad, below 2/3 of the retromolar pad. I keep the wax below the retromolar pad, and also the wax should be toward the weaker ridge. And as you see the ridge, this case is a flat ridge, therefore the lower occlusal plane should be toward the lower ridge as much as possible to improve the stability of the lower denture. After adjusting the wax, I take the trial denture base and I will put it in the cold water. Then any excess wax, I remove it. I don't need wax on the retromolar pad area. I make a slight bevel from posterior. Any excess wax present at the labial part, I don't need it. Just trim the wax. I take the upper and the lower together to check the even contact between both occlusion blocks. I place the lower, then the upper. I guide the mandible and ask the patient to close it. I check the wax. You can see that there is even contact between upper and lower wax. No space is present. This is the first step. Second step, now I have to check the vertical dimension. To check the vertical dimension, I have to get a pen to make a mark on the tip of the nose and a mark on the tip of the chin. You can see there is 2 marks. Then I have to measure the vertical dimension of rest. There are many ways to check the vertical dimension of rest. First of them, to keep the patient at the upright position, and keep the patient at the rest position. This is the first technique, is called physiological rest position. And I start to mark 2 marks. This called R, resembling for rest position. This is the first technique. The second technique is asking the patient to say letter M, نقول ميم. and I measure again to check it is the same distance. Third technique is asking the patient to swallow, then wait after swallowing to check. نبلع ريقنا يا عم الحاج. After swallowing, I wait until the mandible falls down and the lips are relaxed. You can see they are all the same. This means that the rest is a repeatable position and it can be recorded many times. After checking the rest position, I get my lower and place the lower and ask the patient to close. When the patient closes now, this is vertical dimension of occlusion. It should be below the rest by 2 to 4 millimeters. Now you can see it is below the rest by 4 millimeters, and this is acceptable for me. And if you look at the patient aesthetics, it is acceptable. It is not stretched or not wrinkled. The patient is relaxed. If you look at the muscles of the chin, it's relaxed, it's not stretched, and the patient is relaxed. For a flat ridge, we prefer usually to keep the lower occlusal plane toward the lower arch. Now, I adjust the upper and the lower for the vertical dimension. Next step is I have to mark guidelines for me. Midline and a canine line. These lines are a guide for me during centric relation. After adjusting the vertical dimension, I'm going to record the centric relation. I have to train the patient how to close. نرجع لساننا ونقفل. The patient now closes centric. I guide him to close in centric. While closing in centric, I get a wax knife. At the midline, I pass a line cutting from the upper arch to the lower arch. And at the canine lines, or the corner of the mouth, there are 2 lines. On the other side, I mark also the canine lines. These lines are guide to me during closing centric. They should be coincident with each other. I remove the upper and the lower, and I want to lock the upper and lower together. I will make a V notch in the upper, in the premolar area. The V notch should be at the premolar area as location, and it shouldn't be wide and slight depth. You can see I just insert my wax knife and I remove it, not more than that. On the other side, by the same technique, I just insert the wax knife and I remove it. You can see I have 2 notches present at the premolar area. The function of these V notches is to lock the wax that I will place it for locking the upper and the lower. I can lock the jaw relation by different material. The material used should be very soft so that it does not interfere with closing. Otherwise, this will result in shifting of the trial denture base during recording the jaw relation. So, I can use soft wax or even light rubber base or even zinc oxide genol. All materials can be used so that they can guide the patient to close to give me proper centric. I keep softening the wax, just 2 or 3 layers. I take the wax, I place it at the posterior area on either side. The wax should be very soft with me. After placing the wax, to ensure that the wax is very soft, I'll get my wax knife and start to cut the wax into pieces to keep the wax very soft, so that when the patient closes, it does not place any forces or interference or cause shifting of the lower trial denture base, to give me proper centric relation or bone-to-bone relationship, not an acquired relationship. I keep softening the wax as you see, to keep the wax very soft. Even it's like very soft, like you can see. I hold the lower trial denture base. I seat the lower in position. I get the upper, I seat it in position. I guide the patient. اقفل يا عم الحاج. The patient closes. You can see that the guidelines are coincide with each other. The canine lines, you can see it, and the midline on both sides they are guided. Excess wax will come outside the trial denture base. I wait a little bit so that the wax start to harden. Then I will remove them as a one block together. After I remove it, I have to check there is no interferences between the upper and lower trial denture base. No interferences. That's why I remove a little bit from the acrylic resin from the lower at the retromolar pad so that it does not interfere with the upper. I place the wax in the water to allow the wax to harden. Don't rush and open the trial denture base, otherwise the wax can be distorted. I don't want to distort the wax. I get my wax knife and slightly, slowly, I start to open the trial denture bases from each other. If you feel that the wax is still soft, you can place it again back, and I open. You can see the projections that comes inside the notches. This is the projections that can help me to recheck my bite. Any excess wax should be removed because it acts as a guide for me. I just need the wax at the projection. You can see I remove the guiding wax. I don't need all that excess wax that is present. Slowly and should be gently, and the wax should be hard so that you do not disturb or distract the wax that you did it before. I remove the excess wax. I leave only the projections with me. I go to recheck and verify that it is correct. That's why this technique is called wax wafer technique or checkbite technique. It's called checkbite because I can recheck the bite. I guide slowly, then close. Slowly, you can see that the notches comes inside and the wax is, the guiding planes are coincide with each other on both sides, the midline and the canine line. This means that my bite is correct. Thank you.